The open enrollment period for Medicare and the Affordable Care Act are opening up soon. This means now is the time that we want you to start thinking about coverage plans as we are heading into this next year. So navigating all of the different healthcare changes can be difficult, but we've got experts with us today to help sort everything out. So we have Catherine Sevier with AARP, Steve Edmonds with Alliance Insurance Services, and Laura Packard from Healthcare Voices. They're here to answer your insurance-related questions. Here's how you get your questions to these experts. The number is 336-379-5775. When you text your question, it is anonymous, but we answer it in live time right here on TV so that we can get that for you. All right, let's first and foremost, Catherine, let's talk about the first one that is coming up for enrollment, and that is Medicare enrollment.
That's right. And Medicare enrollment is starting on October the 15th, runs to December 7th. If you have a supplemental plan or if you have an Advantage plan, you need to be thinking about any changes you might want to make, because this is the time to make them. Why you might want to make a change is a change in your health care, the change in the drugs that you're taking, but take a good look at it. Medicare has just come out with their new handbook for 2024, and it's online, and it's Medicare and You 2024.
Okay, so this is open enrollment for Medicare starting in October. That means if you have Medicare and you want to switch some things around, this is your open enrollment time. We're going to get to when do you sign up for Medicare a little bit later on in general. All right, Laura, let's tackle ACA. This is a little bit later in the fall, but it's still something we need to keep on our focus.
Yes, open enrollment for next year starts on November 1st and runs through January 15th. But if you have a qualifying life event, like you move or get married or have a baby, something like that, or if you lose your health insurance, then you are eligible to sign up anytime at healthcare.gov.
Okay, and Steve, what I want to talk to you about is, because you are an independent insurance agent, a lot of people are going to be choosing their benefits in October. That's when all the employers kind of do their benefit packages and stuff. What do you think people should keep in mind?
Well, a lot of time employers will offer a diverse package of benefits and let you choose. And so the things to keep in mind is you probably want to look for a plan that has lower deductibles, especially if that's available and the cost is not really high. So lower deductibles if possible, good preventive medicine. A lot of plans have really good benefits for that. So just look for those kind of things. And also some attractive versions of health savings accounts. You really need to look into those kind of things, because a lot of times you can deposit money into a health savings account and you're able to take that off of your taxes at the end of the year. And a lot of times people overlook that, or they just don't get a lot of information on that of how it could help them going forward. So be aware of all those things.
Okay, great information. All right, Catherine, let's go back to Medicare. Open enrollment, of course, is in October, starting at that time. What new things are happening or coming down the pike through Medicare?
So Medicare had a number of legislative changes in this last year, and one of the things that will be changing is what drugs are, the coverage of drugs. We've got this new insulin coverage that makes it a much more affordable thing for folks. They've now listed the top drugs that they are going to start to cover differently. So it's really important for people to know what medicines they currently take and make sure that they are looking at the plan that they want to select, whether it's a Medicare Advantage plan or whether they want to stay with standard Medicare Part A, Part B, and get a supplement.
All right, and I know this is something that we kind of talk about every single year whenever healthcare is talked about, whether it's Medicare or whether it's ACA. Some people will say, well, whatever plan I'm on, it's fine. I don't need to re-up or do anything like that. Laura, you would definitely say make sure you look at all of the options.
Yes, even if nothing in your life has changed, the plans and the insurers are always changing. So you can just let it go to default and auto renew, but you will probably get a better deal if you go back and shop and look at all your options.
Mm-hmm. All right, and there was something specific that you wanted to talk about, the unwinding.
Yes, Several this is a big thing in North Carolina and around the country. People that have gotten health insurance through Medicaid in the last couple of years through the pandemic, you may have gotten something in the mail or gotten a phone call saying that you need to submit some information on your income to keep your Medicaid insurance. This is called Medicaid unwinding, where states are now going back through their Medicaid rolls and checking to see who's still eligible. So if you get something in the mail, check it out and make sure to take all the steps you need to keep your insurance. And if you are no longer eligible for Medicaid, maybe you got a new job and you're making more money now, then you should go to healthcare.gov and check out your options, because you may be getting dropped from Medicaid shortly.
Okay, and that is very different, Medicare and Medicaid. Steve, did you have something to add in on that?
Well, I think one of the most important things to at least to remember about this unwinding, it is affecting a lot of people in the insurance world. We're getting tons of calls about this. And if you are dropped from Medicaid, so if you become a casualty of that due to this unwinding process, you have a special enrollment period that triggers a window that you can call in and you can get insurance through the Affordable Care Act if you do it within a timely manner. You know, I would focus on 60 days, on a 60-day window there. And so just, you know, check that out quickly. Don't wait, but do it quickly.
Okay, the question I'm going to ask you when we come back is what happens if you threw away that letter and that kind of thing? What do you do now? We're going to tackle that question. Plus, I'm already seeing questions come in from you. We'll be tackling your questions when we come back.